Well, my name is Dr. John Schellenberg. I'm a chiropractor and I'm a certified NET practitioner. NET stands for Neuro Emotional Technique. My background, I actually grew up in Niagara Falls, Canada, and moved to the Fargo-Moorhead area in 2004. I graduated from the Canadian Memorial Chiropractic College in 1999, and I got into practice in Ontario, and kind of was led more into a holistic approach very shortly after starting into practice. So we were here. I met my wife, who's from this area. We practiced together for a couple years. We sold the practice, moved to the Scottsdale, Arizona area, and then we just recently came back last fall. Well, it's interesting. I actually wanted to be an optometrist when I was going to school, and they didn't want me, so it's one of those things. It was like this big hand guiding me away from what I thought I wanted to do and into something that I really didn't know that much about, and one of the things that I'm absolutely so blessed to be doing, because I love it. I can't wait to get out of bed in the morning and come to work, because it's not work, it's play. And I think if you can find something that, if you do what you love and love what you do, it's not work. And I found that. So I guess I kind of found chiropractic by default almost. And the interesting thing about it is it's so much a part of my life now that I'm just so thankful for it, and it affords me a wonderful life with my family. How I got into more of the holistic approach was starting out in practice. I very quickly developed and built a very busy practice. And it's interesting because one day going between rooms, I had 4 rooms, and going between patients and rooms, this voice came out of I don't know where, and it said, "Hey, would you go to you?" And it stopped me dead in my tracks. Because my answer right away said no. And I'm like, what do you mean no? Well, I'm not a bad guy, thinking, like, why not? And so then, it's like I was having this conversation in a split second between rooms. And the answer was, well, because you don't do what you would want other people to do for me. So I thought, wow, that's interesting. I wouldn't go to me because I'm not doing the things I would want to receive. So that stopped me dead in my tracks in my career, really, and started me in a brand new pathway of finding out who that is. And this is literally 13 years later, and it's ongoing. It's a work in progress, but I think I'm a lot closer now to what that looks like. And what that is really taking time with people, digging into the core of their being on a lot of levels, not just adjusting spines in 2 minutes and moving on to the next one. I actually take time. I actually spend a good half an hour with most of my patients, and we're working on very, very different levels than just a structural approach, which is how we're taught. It's actually a 117-year-old model or 118-year-old model that we're trained in. Unfortunately, the patients that come to us now are modern, and so we have different stressors. We have, 100 years ago, agriculture and industry, and that was, physical stress, and that still exists to this day, of course. But there's a lot more neuroemotional. There's a lot more psychosocial, cultural type issues that come up. There's more toxins in our environment. In fact, I've heard there's 10,000 new toxins a year dumped into our environment we don't know the names of. There's a lot more toxicity. And nutrition. There's a lot of processed foods, a lot of junk food, and maybe the soils are depleted. So there's those 4 components that we start looking at in order to really try and get into somebody, into their health, and really make a lasting difference for them. Healing actually takes place in the mind. It doesn't take place in the body. Pain, suffering doesn't take place in the body, although we think it does. Health and wellness is really a decision of the mind, but not on this level, on a much deeper level. And so health and wellness is a state of loving ourselves and undoing our own ego. And that might sound a little bit interesting or weird coming from a chiropractor who might just adjust your neck. And how that relates is hard to bridge that gap. But that's really where it's at, is healing in the mind at a much deeper level. So Neuroemotional Technique is a very powerful way of looking at any emotional component to why somebody isn't healing. It's removing an emotional block to allow somebody to heal, or that's preventing somebody from healing. And it's an involved system where emotions in the body can get trapped. Now, they're not bad. We all have them. We all get angry. We all have resentment. There's always grief. They're all normal. Everybody has them, and there's nothing, inherently wrong with any of them. Then the problem is, well, there's a process that the body's supposed to go through. It's called extinction. So when the emotion goes through an extinction process, then it's done. And extinction means gone, right? It doesn't exist anymore. Well, if it doesn't go through that normal process, it gets built up in the body and it gets stored somewhere. It can get stored in the tissues, it gets stored in the joints, it can get stored in the organs, anywhere. And that can lead to disease or some kind of dis-ease or some problems, health problems. So what NET does is it can, using muscle testing, it can very, very quickly and like a laser focus in on an emotion that is still charged in the body and being held. That might be in conjunction with a feeling or a body entry, what we call a body entry, or like a problem, so like a headache or a neck pain or a knee pain or a wrist problem, for example. So NET will find the emotion, will help a person find a snapshot or an event in time, either current or in the past. And the reason why that works is because this is delving into the subconscious part of the brain, which doesn't know the difference between past, present, and future. It's all right now. The reason why muscle testing works for congruency and incongruency in neuroemotional technique is because the subconscious part of the brain is what's involved in muscle recruitment. So if we push down on an arm, for example, and I like to demonstrate this, everyone knows what that looks like, the subconscious brain will recruit a lot of muscles and there can be enough resistance there to hold it strong. And if we say something that the subconscious brain is no longer congruent with, it will recruit less muscles and the arm will go weak. Okay, so now we have a way of communicating with a person. We have a way of communicating with the subconscious mind, which is where all the answers are, using this muscle testing technique. And that's like a binary code. It's the language of the universe, binary code. We have a strong or a weak, a 0 or a 1. It doesn't mean yes or no. It's actually testing congruency or incongruency. So the point of the matter is with a neuroemotional complex, or what we call an NEC, if somebody has an NEC associated with either a mind entry or a body entry, then we can go in using NET and the 15 steps in the procedure to find an emotion, find a snapshot of an event in time where that emotion was originated from, and through a very simple procedure, let those emotions go into extinction. And extinction means they're gone. Now, it doesn't change history. But what it does is it changes a person's perception of their history. And we're always dealing with emotional reality, maybe not even historical reality, but emotional reality. And emotions are physiological, and that's what creates your reality. So when it goes in through extinction, they're gone. And you never have to go back and redo the same one twice. So it becomes very powerful because you're actually healing something at its core. We generally spend about a half an hour with a patient. It'll start with, just a brief little, hey, how you doing? What's going on? Is there anything in particular you need to work on? I get patients that have all kinds of issues coming in. They come in with everything and anything. If they're coming in with a specific, disease process or something, we might be targeting that and peeling the layers off the onion of that disease process. Or they might just say, hey, you know what? I'm doing great. I just want to come in and, get whatever emotional layers that have, built up between the last time and now. I want to get them dealt with. So, people will come in with a laundry list of things they want to work on. And so a typical office visit is, hey, is there anything particular you want to work on today? And I always tell people, look, I work for you. So, I might have my agenda, but people come to me for their reasons, not mine. So I'm always going to work on whatever they want to work on first. And so we'll start with a series of muscle tests to determine what it is we got to do. Each and every visit starts with a mini examination. And it's a very pointed examination, so we can find out exactly what we need to do. There may not be structural components. So as a chiropractor, you can come to me and not get a physical or structural adjustment. Because if there isn't a structural component playing itself out, then I don't need to do anything with it. Even if the nail is driven in, you don't need to hit that nail again, right? So in our model, in what we call a biopsychosocial model of healthcare, which is what we're working with here, in this model, we're going to look for structural components, we're going to look for neuroemotional components, toxicity components, or nutritional components of anything. So in the home run formula on the bottom, and this was developed by Scott Walker, There's structural or physical correction on home plate. There's NET or Neuroemotional Technique, emotions on first base, toxins on second base, and we use those homeopathic remedies. There's little spray bottles to clear out to clear out the toxicity component. And then there's nutritional. If there's deficiencies, we use whole food nutrition in order to find any of those deficiencies. And so each visit will be different depending on what we're working on. We'll look at what components are causing that particular issue, whether it's a mind entry, whether it's a body entry, and deal exactly with what the body needs on that particular day. Well, it really deals with the core of their being. We have the reptilian brain, the mammalian or the subconscious brain, and the neocortex brain, or the neocortical part of the brain. So there's three brain parts, really. On the right side is the conscious part. It's where we use our reasoning, executive decision-making, mathematics, composition, invention. You know, when we're in university and you're in studying mode, that's what you're using mostly. The one on the left is just quickly, the reptilian brain is about survival. So, you know, feeding, fleeing, fighting, reproduction, that kind of stuff. Think about a crocodile. That's all it cares about. It's a reptile, right? And then in the center, well, that's Big Brother. That's what's running the show. There's programs that are happening inside that subconscious part of your brain. That's where your emotions are. If you go down, you see timeless. There's no today, no tomorrow, or yesterday. All that ever was simply is. But it's your subconscious mind that's running your show. It's what's running your life. It's, you know, we make decisions. We have no idea why we make decisions. We don't know why we do what we do. I know a lot of people have tried to lose weight. Okay, so, you know, they know if you're trying to lose weight, you know darn well, right? Don't stand in front of the refrigerator at midnight scooping yourself some ice cream. I mean, everybody knows that, right? You're supposed to eat right and exercise if you want to lose weight. Okay, that makes sense. But yet, the net result of like every diet is a gain of like 4 or 5 pounds, I think it is. So there's something else playing here, because if we all just, you know, I mean, if we were really living our life through the neocortical part of our brain, then we wouldn't do these goofy things that we know aren't good for us, right? We still do them. That's because it's a program that's running in the subconscious. Now, the subconscious mind is developed and literally finished being programmed by the time a kid is 7 years old. So by the time you're 7, that subconscious part of your brain, where all your programs are formed, is done. The open sign gets flipped to closed. So, we're living our lives based upon the programming and who programmed us in our first 7 years of life. And because it's closed, now you can't access it unless you have a very, very specific technique that can get into the subconscious mind. Well, remember I said at the beginning that muscle testing is a way, muscle recruitment is controlled by the subconscious mind. So if we have a strong muscle or a weak muscle, now we're accessing the subconscious. And things like NET, it's not the only thing, but it's a very powerful way of getting into the subconscious mind now and removing emotional blockages to why we do what we do and our behaviors that are developed through that programming. So NET really gets to the core for people. Well, it removes that emotional block. You know, if there's the 4 components on the home run formula are structural, emotional, toxins, and nutrition. I'm not saying that's the only thing that's out there. However, I think we can agree that if you handle those 4 components, you're a long way there. You're a long way down the road to get into healing. And NET is a big component. If you look at that chart up there, right in the middle is NEC, or it's the traumatized mind. And that's your neuro-emotional complex that NET addresses. Now you see the arrows go everywhere to all that stuff around it. It goes in, it goes out, and that means emotions can cause anything, and anything can cause emotional distress, and that can cause anything. And right at the core of that is your emotional brain, which is running all your programs from the first 7 years of life. So it addresses the emotional component that could be involved with any disease process. That doesn't say that NET cures everything. That's not what I'm saying. What I'm saying is that if there's an emotional component to any disease process, put that disease process in the middle of the home run formula and go around the bases. And I guarantee if you have some changes as a result of what you're finding, then something's going to shift inside that person. And shift really does happen. Sometimes it's instantaneous. I actually spoke at MSUM yesterday. I was invited to come to the psychology department. I think it was a student affairs. I'm not exactly sure what it was, but I was invited to come and present. And one of the things I love doing in these presentations is live demonstrations of NET. And the reason why I love doing live demonstrations is because it's like if you've never been wet and someone says, you know, describe to this person, what does it feel like to be wet? You know, you'd fumble over your words. You know, like, how do you describe that? I mean, I guess you can be slippery maybe, or maybe, I mean, I don't know. But you could show them a nice pool and say, jump in. So you can experience what it's like to be wet, like it or not. That's going to be an experience that you're going to now have for the rest of your life. So with NET, it's sometimes hard to describe. So I demonstrated. And at this MSUM presentation yesterday, I had a guy who came up with an ear infection. He'd had it for 3 weeks, and he hadn't been able to hear out of his ear for 3 weeks. And well, that was kind of an interesting one, but people come to me with anything and everything. Well, he just so happened to have an emotional component on his right ear, and this lack of ability to hear, and this infection that was going on. So we cleared that emotional charge, that neuroemotional charge, that NEC, that was associated with that in front of the group. It was about 20 people. And when we finished, and it only took maybe 5 or 6 minutes, when we finished, he looked up and he said, I haven't been able to hear out of my ear in 3 weeks, and when you were doing that, it popped. That was instantaneous. He could all of a sudden hear out of that ear again, which was awesome. It doesn't always act that way, because there's a lot of layers. So my honest answer to that question is, how long does it take? I have no idea. I mean, I really don't. And so my approach is always, you know what, if it feels right, let's just keep pulling the layers off. And I work for you until you fire me, is what I tell people. And I'm joking, of course, when I say it, but people will come for their reasons and their reasons alone. So, you know what, because this is such a personal growth process, by shedding the layers, really, you know, it's about undoing all of these programs in the ego, in all honesty, in the mind. We can all get a lot of these sessions done and just get lighter and lighter and lighter and healthier and healthier and healthier. As long as you get your master's, you can learn NET. NET is not exclusive to chiropractic or to chiropractors, although it was developed by a chiropractor, originally taught to chiropractors. There are now medical doctors that do NET. There's psychiatrists who are medical doctors who do NET. There's clinical psychologists that do NET, acupuncturists. I believe I've met a veterinarian or two that do NET, nurses. As long as you have at least a minimum of your master's in whatever the health discipline is that you do, clinical social workers, for example, again, or your doctorate, you can learn NET. And I've studied a lot of things in healing, and I have never found anything that works so fast, so accurately, and so effectively as NET.